Find out what the Western Tidewater Health District Medical Reserve Corps is all about and how you can play a very big part in that organization. Will Drewery, Emergency Manager with the Western Tidewater Health District, is with us to talk about the Medical Reserve Corps. So someone who goes, okay, that sounds like a very important name, it's a very important group, but these are volunteers in our community.
Yeah, so
what do they do?
The MRC, they're a bolt-on unit to our health department. A lot of health districts consider them as their volunteer unit. We really consider them a part of our full-time public health staff. They help us with every aspect of public health. They've been very involved in our COVID-19 efforts, obviously, because that's what public health has been dealing with. But they bolt on for other things too. We've had MRC folks who help us out when we've had folks call in sick in our clinics just for normal reasons. Right. They help us out in our hurricane shelters. They do all kinds of things, and they're really that ancillary unit to the health department that helps us out when we get really short.
And when we talk about the MRC and the volunteers, men and women who make up the group, you're not talking about just this type of person or that type of person. You've got a broad base of skills, abilities, ages mixed in there. So when y'all are looking to recruit, what are you looking for in the type of person? Is it just a desire to help or what?
Right. So really the desire to help is the biggest thing. Volunteerism is or want to volunteer is really the biggest thing. We're not looking, a lot of people think when they hear Medical Reserve Corps, we're only looking for medical types of people.
Right.
That's not true. We need people who can lift things up and put them down too. We take nurses, we take doctors, LPNs, but we also take just the folks who want to do administrative tasks. We have teachers, we have secretaries, we have accountants. I even have somebody who is retired and has been retired for some time, hasn't worked, and just they give all the time that they can give to us. It really takes all types of people. It's not honed in to just medical types of people. Right. So when we advertise and when we recruit for folks, we're looking for really any able-bodied person that can come give us a hand.
And I think you stressed it already, but the fact people hear the word medical and kind of stop right there. But these aren't always necessarily directly medical situations that you're using the volunteer. These is group win, right?
So we have a group of folks who we use for clinical functions. Folks who collect for COVID collect NP swabs. Once we get to flu season, these are folks who will be given flu shots. But we also have administrative, clerical, folks that need to do registration, folks that need to do logistics, packaging things up for it, getting supplies where it needs to go to help folks out. It really takes all kinds. Really takes all kinds for us.
Now, because you're open to a very diverse group of people who want to volunteer, do y'all do any training or how does that work? So someone comes in, knocks on the door, puts in the application or whatever the process is, and we'll get to that in a second. I want to help.
Right.
Is it a matter of, okay, work with them, let's find out what your skill set is, and then you put them in that skill set, or do you try to, if they want to learn something, do you have the ability for them to kind of learn on the job, get some training, or how does that kind of come together?
So through the application process, we kind of identify who can do what.
Okay.
But we do provide all the basic level training. If somebody comes to us and they don't have the basic training, which is CPR, the basic NIMS and ICS courses, we provide all that for them, and then we provide the orientation for them. It's important to note that these folks that come in to volunteer with the MRC are credentialed just like a health department employee is. So they go through a very similar application process as far as a background check and things like that. So we will provide all the training that's needed to get started, and then if there's something specific to the skill set that somebody already possesses when they come in, we can definitely adapt to what they already have when they come to us.
So if someone is watching this program and they say, look, I'd really like to be a part of this, or I'd like to give my time to help my community out, how can they apply and what is the process like? You mentioned it's very similar to what the Department of Health does, but what's the entry point for people to get in touch with you?
So all you have to do is you go to the Virginia Department of Health website. You look for the Medical Reserve Corps page there, and there's a link on there that says click to apply. When you go through the application process, it's going to ask you basic information, name, demographics, your address, things like that. And then once you get towards the end of the application process, it asks you which unit you want to be affiliated with. We're the Western Tidewater Health District, so it's the Western Tidewater Medical Reserve Corps. Obviously, we want folks to come join us, but if there's somebody watching who wants to join another unit, that option is there for them. Once that application is completed, it comes over to us. We see it. We send them a welcome email. We give them a phone call, say, hey, this is your next step. Right. Complete the orientation. Once you've completed the orientation, you get a background check. Once your background check is clear, you're good to come to work.
Okay. And how quickly do you typically implement new folks that have gone through the setup process, they're ready to roll, and also talk a little bit about how the process works. You have an event or a situation where you need to pull from this group. How does that process work too?
So once your background is back, you're considered good to go.
Okay.
Like I said, we provide all the training as on-the-job training for whatever hazard we're facing, a pandemic, hurricane, whatever it may be. Once we decide that the MRC needs to be activated, and through COVID, we're on an ongoing activation.
Right.
So there's many different events that we're doing throughout the week. The biggest one is our testing events. There's a mechanism that we have to be able to alert the volunteers. They get that alert through a phone call, a text message, and an email. They go into their email, they click a link, they're able to see what's available, what they can do to assist us. If they feel comfortable with it, or if they don't feel comfortable with it, they can mark available or unavailable.
Right.
And if it's something that they have a question about, then they can email us back and say, hey, what really is this?
Right.
Am I able to fill this role?
Right.
So it's a very, very streamlined and seamless process. It's very easy, and it's really nothing to be afraid of.
And we're talking specifically, and certainly that's where your recruiting pitch goes for the Western Tidewater Health District, which is not certainly just Suffolk. You're
Right.
talking a pretty wide swath of area that you're trying to cover. So the key is getting as many people, diverse skill sets, the ability to place them and utilize them as they need to within the area. And I think you said you have a little over 200 folks in the program
Yes, sir.
right now. So you talked about the COVID testing, and I think they've been very critical in the sense of giving you men and women's bodies to be out there to help do some of the legwork when it comes to having these testing events, right?
Right. So in July, when we did these pop-up testing events, really throughout the district, but particularly in Suffolk, the pop-up testing was 100% facilitated by the MRC unit. The only involvement that the paid VDH staff had to have was getting the stuff there to be able to host the testing event, and then acting as a liaison between whoever was hosting the event
Sure.
and VDH.
Right.
Once that happens, we turn it over to the volunteers, and they handle it 100%.
Right.
In July, 15% of the total testing encounters for our district were completed by the MRC. And we're doing the same thing in the month of August. So far, 18 to 20% of the testing encounters so far in the month of August have been completely 100% facilitated by volunteers. So it's actually it's a really, when you think about it in terms of numbers, we're a small unit,
Right.
but we're putting out a lot of work, and it's something we're really, really proud of.
Well, I think just with the COVID situation alone, you talked about the impact that they've had on the community throughout the district, and the fact that the work they're putting in, and the fact that they're taking the load off of some of the paid folks, which makes it more economical for maintaining the health system in that respect. But also the fact that, again, these are people in the communities that are doing work in the communities that are making such a difference on the local level. And we're in the middle of hurricane season too, in case we didn't know that already. And you talked about shelters and things like that crop up, flooding events. I know they've been very critical with that. So it's not just this type of situation, this type of role. There's a wide variety of things that
Right.
can pop up, and the call goes out from y'all and people respond.
It's important to remember that if we didn't have these volunteers, we'd be having to close clinics.
Yeah.
And people still need the health department for the services that they need every day.
Right.
To be able to facilitate the testing of just the testing events as an example, it takes 8 people for each event. 8 people for us, since we're a very small health department, is 1 office. So
Right.
that shutters an office for that day.
Right.
Same thing as far as case investigations go for COVID.
Mm-hmm.
We're bolting MRC folks onto our paid staff to help assist with case investigations. If we couldn't do that, we'd have to shut our operation down completely. So I cannot stress how important it is, how important that volunteer
Right.
unit is. And you, Tim, you alluded to hurricane season also. If we've gotten a situation a couple weeks ago when ICES came through,
Right.
where we had to open shelters up. And the MRC, we were notified at 5 o'clock in the morning, and in 30 minutes we were ready to open.
Right.
We were ready to open the shelter at Kings Fork High School with just volunteers.
Correct.
So
Correct.
I can't say enough good things
Right.
about them.
And I think that goes to show as well, it's individuals who care and want to help, but it's also the fact that they're trained, they know what to do. The whole health district knows what to do when these situations crop up. Certainly COVID, we've kind of had to figure some things out, but now that we've kind of ironed that out, everybody's working through it and know this is what we need to do, this is how we're going to do it. But the fact that the training's there, the want is there, the skill set is there, and working again with you and the rest of the paid staff to coordinate together to make this health district click when it comes to COVID or any other situation we find ourselves in.
Yeah, it blows me away the amount of work these volunteers can do, and they really, whatever is asked of them, they they 100% go to bat for us to do the right thing. When I first started working for the health department, the nurse manager told me that the folks here in the district would move mountains to do the right thing for the folks, and that extends down to the MRC. So,
now if someone is watching this program and they're thinking, I'm on the fence. It sounds like a great idea, but how would you finish that sentence? What would you say to get someone to take the step to fill out the application, at least start the conversation?
Right, give us a try.
Yeah.
Fill out the application, get to know myself, get to know Connor, Connor Smith, who's our MRC coordinator.
Right.
Get to know a little bit about the program. Give us a shot. We will find something. If most people are reluctant, again, because it's medical,
right,
that they don't think we can find a role for them to fill.
Sure.
We can certainly, if there's something that you want to do that has to do with public health,
right,
we will find a role for you.
Perfect. Well, I think that's definitely the sales pitch, if there is such a thing, for what we're talking about. But appreciate the time. And again, you mentioned the fact they can go on the Virginia Department of Health website, look up, and we'll have that URL on the screen to probably redirect them from there. But it's really that simple to get that ball rolling and then figure out, again, how you can fit in, how the organization can utilize you, and then get that done. Everything gets cleared out. You put them to work.
Yes, sir.
Perfect.
Yep.
Well, thanks for your time today to talk about the Medical Reserve Corps, a key component here with the Western Tidewater Health District, making a real big difference in our community, especially in these COVID times where times are changing, and certainly the Medical Reserve Corps and the Health District are changing with those times. So we appreciate everything you and your staff are doing to make everything work here and keeping us safe and sound as best we can.
Yes, sir. Thank you.
That would do it for this edition of Healthy Living. I'm your host, Tim Kelly. See you next time.